Do you ever get really confused when you're like sitting in an exam and you start hyperventilating, you start not able to focus on the questions, and you think to yourself, is this anxiety? Is this ADHD? Maybe my anxiety is causing my ADHD, or is it my ADHD causing my anxiety? Which one is it? Well, that could be really confusing, and I'm going to try to break this down to make this simplified and understand what is the difference of ADHD and anxiety, and can you have both, and what do you need to look for, and what treatment options should you look at when it comes to ADHD and anxiety. Before we get started, if you are new here, go ahead and hit the subscribe button, as well as if you like this video, give us a thumbs up, as well as also check and hit the notification bell so you don't miss out on any of our future videos. Hi everyone, I am Dr. LeGrand, and I have ADHD and dyslexia. Grew up with it, as well as I also grew up with anxiety, especially when I was in school going through college, medical school, definitely had anxiety. And this is a question that a lot of us people who have ADHD ask ourselves. Or maybe a parent that might be working with a kid that doesn't understand, does my child have anxiety? Does my child have ADHD? Which is it? I see this a lot. A lot of patients do come in, and when they're trying to get their child assessed to understand, is it ADHD or anxiety? Is it both? What can it be? Well, let's first break down the differences as far as ADHD and anxiety. Now, as you know, with anxiety, usually what you need to look at anxiety as, it's more episodic. It can happen frequently throughout the day. Sometimes it could be just a couple times out of the week. But how you understand, usually this is where we ruminate a lot. We stress a lot. We tend to actually fear things that haven't happened yet or already have happened. This isn't ADHD, whereas ADHD is actual a disability where, a mental illness where we can't concentrate. And this is constantly going on, or we can't do a task, or it might be hyperactive. This is something that's continuous throughout the day. It isn't something that's episodic. Whereas anxiety tends to be more episodic, where you'll tend to even have maybe an anxiety panic attack. Now, it can be confusing sometimes because sometimes being more anxious and stressing and thinking about things can have us forget things or tend to have us hard time focus. But you got to understand that could be episodic. So if you find that this only happens every so often and not constantly, it might be just anxiety and maybe not ADHD. But if you tend to have both, where you are constantly can't concentrate or focus, and you tend to be more hyperactive, these are things that are more contributed to ADHD. And then you might really ruminate and stress about every so often, maybe once a day or a couple times out of the week, then you do have both. So just understanding those differences is really important to kind of break down. So is it possible to have both anxiety and ADHD? I would say yes, it's actually very common. In fact, there's a lot of statistics out there where showing that adults with ADHD, about 50% of them had contributing factors of anxiety. This was talked about in Medscape if you want to look it up. The other thing is that they also found kids with ADHD tend to have about 30% of also having anxiety. So it is very common to have anxiety and ADHD. The question that you need to ask yourself, though, is, okay, what are the treatment options? What do I need to focus on? Do I just focus on, ADHD treatment? Do I focus on anxiety treatment? Do I do both? So I want to kind of also dive into that as well. So the first and most common one, of course, is, ADHD medications. There's also anxiety medications, but a lot of times, ADHD, when you start taking ADHD medications, can also help with the symptoms of anxiety because they're very similar as far as what's going on in the brain and brain activity. Now, this has been exhausted a lot. I kind of want to dive into some other things that are not talked about a lot that I try to work with my patients as far as, things that they need to start implementing other than just medications. Now, if you're somebody that doesn't want to use medication or haven't, started using medications, that's fine too. These are things that you could implement depending on how your severity of your ADHD and anxiety are. But you always need to check with your doctor first before implementing anything. The other common thing is also doing cognitive behavioral therapy. If you don't have your child, or if you haven't done this as an adult, something really to start implementing more that can help both with ADHD and anxiety, and something you should be continuously doing on a consistent basis. Now, when it comes to looking at other options than the common things that you get from your doctors, take this medication, do some cognitive behavioral therapy. I'm sure this is very common amongst the ADHD community. Let's talk about things that are not talked about enough. Let's talk about nutrition. So nutrition can be a huge hindrance for mental illness, especially for anxiety and ADHD. If we are not getting good nutrition value, our brain needs to be fed. So healthy fats, healthy proteins, healthy vegetables, vitamins, minerals that need those building blocks. Things such as, getting good enough electrolytes. Some kids and people with ADHD, if they incorporate more magnesium, we tend to be a little bit more deficient in that. That can always really be helpful and beneficial. But trying to get a good balanced diet is always really important to help with anxiety and ADHD. The other thing to also implement is exercise. Exercise can really help improve mood, can help us to de-stress, as well as can help a little bit with focus. So making sure you get good quality of exercise on a daily basis is always really something that we should always be trying to strive to do. Now, the other thing is sleep. I think this is not talked about enough when it comes to people with ADHD. It's actually very common. I see a lot of my patients that their ADHD is lacking. They're not getting enough sleep. And of course, that can actually make ADHD anxiety even worse if you have lack of sleep. So if you have issues with sleep, you should be seeing a sleep specialist or looking at some things that could be possible that can help. Sometimes melatonin, but sometimes melatonin doesn't work. So I always tell people try melatonin time release if you have a hard time staying asleep. Usually trying something like melatonin time release so it slowly releases it, because melatonin will actually help you only fall asleep. So taking something like time release helps you stay asleep, or even 5-HTP. Now, you got to be careful with these things. You always got to check, especially if you're taking medications. Some of these can be interactive, so you always got to check with your doctor first before implementing any of this stuff. I can't stress that enough. So, Dr. Legrand, what about, supplements? I heard I could take this or this that can help with, anxiety and, also my ADHD. Yeah, there is some helpful, supplements that can be supportive. Just as we know, ADHD is just not a quick fix. Here, take this and you're cured. No, ADHD is something that, we live with. I've grown up with my whole life. And yeah, I've taken things and I've done things that have helped me be able to improve things, but it's always there. It's just knowing how to live with ADHD, and it's part of you. Understanding that ADHD is part of you, and anxiety is actually very easily managed if you start working on some techniques. So I've already mentioned, certain supplements that you can take, such as magnesium, melatonin for helping with sleep. Other things that you can take if you're looking for herbal things, I would say, is trying to take anxiolytics. What those are, usually something like chamomile, lavender, rosemary, stuff like that are more anxiolytic types of things. Also California poppy. These types of things, or kava, these types of herbs are known as anxiolytics that help with more calming. They can be helpful, but again, they can be interactive if you're taking certain medications, so you always have to be careful. The last thing I want to talk about that can help with ADHD and also anxiety is meditation and neurofeedback. So meditation can be really helpful as far as calming down, helping with focus, but neurofeedback is probably something you haven't heard before. If you heard about biofeedback essentially is hooking up sensors to actually monitor heart rate, respiratory rate, even sweat, muscle tension, and giving you feedback of what's going on when you're thinking about certain things. What neurofeedback is actually biofeedback for the brain. So it helps read the brainwave activity. As we know with people with ADHD, usually the frontal part of the brain tends to be a little bit more lacking. And so we look for those certain things that need more exercise. It actually gives exercise for the brain to improve upon it so that you can actually get better with focus and attention. And it also can help with anxiety. So anxiety are usually where brainwave activity is very high and active. So we need to kind of hit that middle ground. Same with ADHD, usually those are the low brain wave activity where you're inattentive. So trying to hit that middle ground of brain activity, that's what neurofeedback will do to help improve upon that. Now, I can elaborate more about neurofeedback if you guys are interested. Leave that in the comment section below if you want me to make a video on neurofeedback. I'll definitely go more in depth about that. But hope that you guys found value with this. So if you are new here and you want to actually learn more about ADHD tips and tricks that we actually do and help you with anxiety and depression, go ahead and hit the subscribe button over here, and also check out our other videos here on ADHD and learning tips that you can actually learn that help people with ADHD. Until next time, this is Dr. Legrand signing out, and I'll see you guys in the next video. Thanks. Bye.